Ladies and gentlemen, welcome once again to another episode. Thank you for joining us. This is the third and last series I have on my AI series for this period, and this is going to be looking at level 3. And if you've watched my previous episodes, you will realize that I said very quickly that we are now getting into level 3 as far as healthcare is concerned. And so this is the right time for you to start optimizing yourself and positioning yourself to take advantage of this, because this is going to be the next level of leveraging competitive advantage as far as your competitors are concerned. So when you look at this level, you have to understand that if you ever had a practice chief of staff who never slept, this is how you need to start looking at level 3 AI, because you're not looking at a person, you're looking at a system, and this is your chief of staff who never sleeps even when you are asleep. And that's one that monitors your production in real time, identifies when a provider's schedule is underperforming, calculates the opportunity cost, cross-references your open appointment slots, and adjusts your next 3 days of scheduling, all before your morning huddle. You show up and all these have been done, it's just working for you. And what if your billing intelligence agents that didn't just flag denied claims like we have at level 2, but it's able to reason through why each denial happened? It drafted an appeal, actually supporting clinical language, matched it to your payer specific policy logic, and submitted it while you are seeing patients or even while you are asleep. These are the levels that we need to be looking at, and this is where healthcare or level 3 AI, or what we call agentic AI, is getting to. So my name is Dr. Hamza Asumah. I've been doing this for a while, and if you haven't done so already, please remember to subscribe, like, and share, because it really puts us in a good place, and you're able to get alerts to our contents very early. So today, this is what we're going to be looking at, and we'll be paying more attention to level 3 agentic AI. In episode 2, we talked about just level 2 automations. We talked about how can you automate your appointment reminders. How can you automate AR management and follow-ups? Simple stuff like that. At level by level 2, it has a ceiling, and you cannot it cannot handle any ambiguity. When anything falls outside the workflow you've built out for it, it just falls apart. It's unable to follow through. It cannot reason through competing priorities. So level 3 is where this problem is being fixed, and it's categorically different because it introduces agents. That's why we call it agentic AI. And an AI agent is not just executing on a predefined script, it's pursuing a goal. And you can have one agent, you can have 2 agents, you can have 3 agents. You can have an agent that supervises agents, right? So there's no limitation to what this can do, because now what this means is that you are defining an outcome, and these agents are going to work to get you to the outcome. If it's one agent who is working to get you there, that's your setup. If it's multiple agents that are working together and are being supervised by a human, that's your setup. But we have a next level where you have different agents working and more or less reporting to one agent who's orchestrating every single thing each agent needs to do. And that one agent is what the human deals with or interacts with, because it's drawing all the workflows and moving things around like a normal human being would do. And that's what I'm saying, this is the next level that you need to position yourself to, because this is where the real disruption will take place. So in practical terms, level 2 will only send your patients like a recall reminder. That's what it'll do, because you define the workflow. So on this day, send this, do this, and it does it for you. Level 3 will analyze which patients are most likely to schedule if contacted today versus next week. It drafts personalized outreach for each one based on their history and preferences, and identifies which one needs human touch point versus which one will respond to automation, and just its own strategy based on response rates without you even configuring anything. So this is how complex that this actually gets. So just like I did for level 2, let's look at where the most ROI would come in when we start looking at level 3 applications in healthcare. And I'm going to be transparent with which ones are available right now and which are 12 to 24 months out, for instance, which are maybe 3 to 5 years out. Okay, so let's talk about the first one, intelligent scheduling optimization agent. This is what really excites me, because when you think about an agent like this, it's continuously looking at your production, and it's looking at what your goal is, and it's comparing that to your provider capacity, and it's looking at your historical fill rates. And when it detects underperformance, a hygienist with, let's say, 3 open slots tomorrow, especially with, let's say, a case complexity mismatch, it reasons through the options, so it pulls a wait list, adjusts the schedule template, it reallocates time, flag for coordinator action. It doesn't wait to be asked, it just does, right? So this is where it's becoming very, very valuable, and it surfaces the insight and then recommended actions together, already reasoned through. This is available now, and it's through platforms like Tibra, Dentrix, and other emerging AI scheduling layers. Implementation really requires clean data infrastructure. It does. That's what it requires. If you don't have clean data infrastructure, this does not work. The second one is a denial management and appeals intelligence, and today denial management is a reactive, labor intensive process. So a level 3 agent changes that entirely. It will ingest your denial data, identify patterns, so which payers, which codes, which providers generate the most denials, reasons through the clinical and administrative root causes for each cluster, drafts appeal letters with payer specific augmentation, and tracks appeal outcomes to continuously refine its own growth. The billing team shifts from processing denials to reviewing and approving agent recommendations. This is in the very early stages at this point, and we have things like Waystar and Olive AI which are moving in this direction. Full autonomous appeal drafting with reasoning is about 12 to 18 months from mainstream deployment, so this is not ready yet. The third one we look at is for multi-site performance intelligence agent. So if you look at people for like a DSO operators and people who look at multiple sites, the most immediate comparing level 3 application is in this space. And an agent that monitors KPIs across all locations in real time. So you're looking at production, collection, new patient volume, hygiene, production efficiency, and identify which locations are underperforming and why. Benchmarks against peer sites within your group, surfaces the specific operational levels that you can pull to be able to get this. So this is like your COO at scale, and it's available now, and we have custom built agent workflows on top of your practice management agent, so they put it on top there, and that can actually suck and give you those analytics that you need. So this is actually available now. And the fourth stage of clinical documentation and coding agent, I have seen so many demos come out of this. It's really emerging, and documentation is always a burden, and it's one of the primary drivers of physician burnout. And level 3 agents are trained on clinical language and coding guidelines to listen to patient encounter, and I've seen this already happen with companies Overjet, who already have a voice, what they call a voice agent. It just listens to the conversations in the background and is able to document or write the clinical notes based on what the clinician's preferences are. So this is fully emerging. We have others like Abridge, Nable, and Suki, which are in the very early versions and trying to get this out. And the fifth one that we are looking at right now that you should be thinking about as you scale into level 3 is what we call clinical triage and diagnosis support agent. And this one is close to my heart because in sub-Saharan Africa, the specialist to patient ratio in many countries is just so low, and one physician would probably be tied to about 10,000 people, or sometimes worse. And a level 3 clinical agent operating in a community health worker level can gather structured patient history, reason through a different diagnosis, recommend first-line interventions, flag high-risk presentations for agent escalation, and route complex cases to the nearest appropriate facility. And this is replacing the clinician because it's No, sorry, this is not replacing the clinician. It's just extending the clinical intelligence to the patient before they ever reach the clinician. And so it's trying to close this gap. This is very dear to my heart because I have practiced in Africa. I practiced for a long time. And this is something that my company is actually looking into and trying to develop some solutions to. So are you level 3 ready? And before you can even answer that question, you need to make sure you meet the prerequisites of being at level 3. 1, you have the data. Your agent is only as intelligent as the data it can access. So if you have clean, structured, consistent, formatted data from your PMS, your electronic health record system, your billing system, and your operational tools, if your data is fragmented across systems that don't talk to each other, or if your team is still entering information inconsistently, your level 3 agent will reason bad inputs and produce bad outputs. That's just a fact. So that's the first. And the first prerequisite is that your data should be very clean and well structured. The second prerequisite is integration. Level 3 agents need to both read from and write to your operational systems. This requires mature AI integrations across your tech stack. If you haven't built a connective layer from episode 2, your level 2 infrastructure, you are not ready for level 3. So you have to look at what those integrations look like. And the third prerequisite is your governance. And this is the one most executives underestimate. An autonomous agent that can make actions in your system, schedule patients, submit claims, flag, needs guardrails. You need to give it guardrails. What can it do without human approval? What requires sign-off? Who orders its decisions? In healthcare, where clinical and legal risk is real, your AI governance framework is as important as the technology itself. You build it before you need it. So this is very important, and I want to drive with you on something. When I talk about AI executives, when I talk to healthcare executives about level 3 AI, the most common response I get is, we are not ready for this yet. And sometimes they are right. There are real infrastructure gaps to close first. But often, or more often, we are not ready. It's a process for we haven't made a strategic priority. This should be something that you start looking at with your organization now. Because once this ball starts rolling, and you are left behind, anything that your organization stands for will revolve around this. And as clinician executives, you need to be able to play this role very well, especially in this series. What is the takeaway here? Level 3 AI is not science fiction. Intelligence scheduling agents, denial reasoning systems, and multi-site performance intelligence are available, and they are rapidly emerging. The 3 prerequisites are data, integration, and governance. You need to have these in place before you think about deploying level 3. And sequential matters. Level 2 infrastructure is the prerequisite for level 3 capability. You build the pipes before you build the intelligence. And your clinician executive identity is your competitive advantage. The leaders who win the AI era are the ones who can translate clinical reality and business strategy into intelligent system designs. So this is something that you need to start looking at. This is something that you need to start paying attention to. And this has been another very exciting episode. I love talking about AI because I know this is the future and it has a big future in healthcare, and we should all be leaning towards it. I will see you again in our next episodes. Do have a great day.